Hello, my name is Consuelo. I am a 44-year-old mother, wife, and family nurse practitioner. Throughout my life, I've struggled with my weight and my own health problems. As a patient, I realize that the healthcare system is not designed to help patients understand their health. Now, in my own practice, I enjoy helping patients learn what is really going on in their bodies so that they can make better decisions for themselves. My motto is good health, good vibes, happy life. I hope you join us and make us part of your health journey. Now, on to today's health talk. Information provided on this channel is for educational and informational purposes only and is not intended as medical advice. I am not your medical provider, and this content is not a substitute for seeking medical care, diagnosis, or treatment. Always consult with your healthcare provider before starting any supplement, medication, or health program, especially if you have medical conditions or are taking prescription medications. Statements regarding supplements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease. Use of any information provided on this channel without first consulting with your healthcare provider is solely at your own risk. Hey guys, welcome back. So glad you're here today. Another video where I'm matching my curtains. Hope you like that. Today I want to talk about the GLP-1 medications. Unless you've been living under a rock, you've definitely heard about these medications. The ads for Ozempic, Wegovy, Mounjaro, and Zepbound are everywhere. And all of our favorite body positivity celebrities have been shrinking before our eyes. As a healthcare provider, I have very frequent requests to start these medications. They have been a real game changer in treating diabetes and obesity. The most frequent questions I get asked are, what are they? How much do they cost? And will my insurance company cover them? And will the results last once I stop taking them? That's what I'm going to be talking about today. So let's get into it. Let's talk about the GLP-1 medications. GLP-1 medications, what are they? What do they do in our bodies? And are they safe? That's our next video where I will talk about tips and tricks to be more successful while taking these medications and how to avoid things like Ozempic face, Ozempic butt, and most importantly, how to avoid gaining all your weight back once you stop. What are the different types of GLP-1 medications? For semaglutide, this is a GLP-1 only. For type 2 diabetes, there is oral Rybelsus and injectable Ozempic. For weight loss, there is Wegovy, now in an oral form as of last month, and an injectable. Then there is tirzepatide, which is GLP-1 and GIP. For type 2 diabetes, there is Mounjaro, which are injectables. They come in a pre-filled pen. And then for weight loss, there is Zepbound, which also comes in the pre-filled pens, also in vials where you have to pull it up, especially if you're a cash pay patient, that's what you'll be getting. And then still in clinical trials is retatrutide, which is GLP-1, GIP, and glucagon. It's currently in phase 3 clinical trials with expected approval at the end of 2026, start of 2027. There are older GLP-1 medications like Saxenda, also called liraglutide. It is a daily injection that is now available as a generic. I won't really be talking about that too much right now. A lot of people prefer the once weekly medications. Even with the generic version available, the liraglutide is coming in close to the same price as the other medications, although we are starting to see some more insurance companies start to pick up on that. So what is GLP-1? Well, GLP-1 stands for glucagon-like peptide 1. It's a natural hormone your body makes in the intestines after you eat. Think of GLP-1 as a meal signal hormone. When food enters your digestive system, GLP-1 is released and tells several organs in your body how to handle that food. Its main job is to help control blood sugar, appetite, and digestion. What does GLP-1 do in the body? Well, GLP-1 works in several important places in your body. It helps the pancreas release insulin. Your pancreas makes insulin, the hormone that moves sugar from the bloodstream into your cells to be used for energy. When GLP-1 is released, it tells the pancreas to release insulin. This happens only when blood sugar is elevated. This keeps blood sugar from rising too high after eating. Why this matters? Better insulin response means better blood sugar control. Second, it reduces glucagon, the hormone that raises blood sugar. GLP-1 also tells the pancreas to reduce the release of glucagon. Glucagon normally signals the liver to release stored sugar into the bloodstream. When GLP-1 lowers glucagon, the liver releases less sugar. Blood sugar levels stay more stable. I know earlier I discussed that retatrutide has GLP-1 and glucagon, which sounds confusing, and I will touch on this a little later in the slides. Third, it slows stomach emptying. GLP-1 slows down how quickly food leaves the stomach and enters the intestines. This means food is digested more slowly. Sugar enters the bloodstream more gradually. The benefits: fewer blood sugar spikes and feeling longer after meals. Fourth, it signals the brain that you are full. GLP-1 also acts on areas of the brain that control appetite. It helps reduce hunger, increase feelings of fullness, also called satiety, decreases food cravings. This is one reason the GLP-1 medications are used for weight management. And what a lot of people will say is, like, it took the little food switch in your brain and turned it off. This is what I think most patients really like about these medications. GIP stands for glucose dependent insulinotropic polypeptide. Say that 10 times fast. It is a hormone made in your small intestines that helps your body manage blood sugars after you eat. Think of GIP as another one of your body's meal signals. When food enters your digestive system, GIP tells other organs how to respond. Where GIP comes from: GIP is released from special cells in the upper part of the small intestine, the duodenum and the jejunum, when you eat, especially when the meals contain carbohydrates, fat, and protein. The hormone then travels through the bloodstream to different organs. What GIP does in the body: first, it helps the pancreas release insulin. The main job of GIP is to help control blood sugar. When you eat and glucose enters the bloodstream, GIP is released from the intestine. GIP travels to the pancreas. It signals the beta cells to release their insulin. Insulin then moves the sugar from the blood into the cells to be used for energy. Again, this is important because GIP only increases insulin when glucose levels are elevated, which helps prevent blood sugar from dropping too low. Second, it helps the body handle sugar after meals. GIP is a part of group of hormones called incretins. Incretins help the body prepare for incoming nutrients. Because GIP is released as soon as food enters the intestine, it allows the pancreas to start releasing insulin before blood sugar rises too high. This is called the incretin effect. Third, it may influence fat storage. GIP also affects fat tissue. It can help fat cells take in nutrients from the bloodstream, encourage storage of fat for future energy. In healthy metabolism, this helps the body store excess calories safely. But in insulin resistance or obesity, this system can become less balanced. Fourth, it works together with GLP-1. GIP often works alongside GLP-1. Both hormones, again, are released after eating, increase insulin release, and help regulate blood sugar. But they also have some different effects. For GIP, it's the increasing the insulin and influencing the fat metabolism, and the GLP-1 increasing insulin, reducing appetite, and slowing stomach emptying. Why GIP is important: GIP helps your body control blood sugar after meals, coordinate digestion and metabolism, and signal the pancreas to release insulin at the right time. Without incretin hormones like GIP, blood sugar would rise much higher after eating. Okay, so retatrutide is a newer medication. still in clinical trials, and it works on 3 different hormone receptors in the body, the GLP-1, the GIP, and glucagon. And so most people understand about the GLP-1 and the GIP because they help control blood sugar and appetite, like we just talked about. The glucagon part is different and adds another important effect. It's a little confusing because earlier I said GLP-1 decreases glucagon. So then why would retatrutide have both GLP-1 and glucagon? Here is a simple explanation of what the glucagon activity in retatrutide does in the body. First, what glucagon does normally. Glucagon is a hormone made by the pancreas. Its main job is to raise blood sugar when it gets too low by telling the liver to release stored glucose. You can think of it as an energy release hormone. Insulin stores energy, glucagon releases energy. What the glucagon effect in retatrutide does in retatrutide, the glucagon receptor is activated in a controlled way. Instead of just raising blood sugar, it helps the body burn more energy. It increases energy burning and metabolism. The glucagon signals the body to use stored energy. This can lead to increased fat burning, increased calorie expenditure, and increased metabolic rate. In simple terms, your body burns more fuel throughout the day. Second, it helps break down stored fat. Glucagon encourages the body to release fat from the cells so it can be used for energy. This process is called lipolysis. So instead of storing fat, the body is more likely to use fat as fuel. Third, it helps the liver use stored energy. Glucagon tells the liver to release stored energy when the body needs it. This helps keep energy available while the medication is also reducing appetite through the GLP-1 and GIP. So you have less hunger, better blood sugar control, and more energy burning. And fourth, it may increase thermogenesis. Glucagon signaling can increase thermogenesis, which means the body produces more heat while burning calories. This is another reason retatrutide may lead to greater weight loss compared to earlier medications. Why this matters for weight loss. Older medications like the semaglutide only worked on GLP-1 and tirzepatide, GLP-1, and GIP. Retatrutide adds in the glucagon. So the GLP-1 is going to reduce your appetite, the GIP is going to improve metabolic signaling, and the glucagon is going to increase calorie burning. So instead of just eating less, the body also burns more energy. Simple ways to think about it. Retatrutide works by doing 3 things at once. It tells your brain you are full, it improves metabolic signaling, and it increases the energy burning. The third effect is why retatrutide may produce the greater weight loss than the earlier medications. Okay, let's talk about semaglutide. This is sold by Novo Nordisk under the names Ozempic, Rybelsus, and Wegovy. Rybelsus is a once daily pill approved for type 2 diabetes. I'm not going to focus much on this medication today. I do have several patients on it that really like it, but it won't be our focus today. Ozempic is a once weekly injection approved by the FDA for type 2 diabetes. It has the indication for reduction in cardiovascular risk and chronic kidney disease, but these are also in patients with type 2 diabetes. So you basically need to have type 2 diabetes to get it covered by insurance or to be able to cash pay, to get it as a cash pay patient. They will not fill the order unless there is a diagnosis of type 2 diabetes. And no, we can't lie about that. We can get in big trouble. So there was once a short period of time, about a year and a half ago-ish, when some of the insurance companies were covering Ozempic for metabolic syndrome. I was happily using that diagnosis to help get it covered for people during that time. But that ended pretty fast. I do think that they panicked when they saw how much they were having to pay out for these medications. If your insurance company does have coverage for the medications, it can cost as low as $25 per month if you use Novo's savings card. I tell all of my patients, I don't care which medication it is, if it's an expensive medication, if it's Ozempic, if it's Mounjaro, or any other high price medication, if you go to Google and Google Ozempic savings card, Mounjaro savings card, whatever medication savings card. Most of these pharmaceutical companies have programs to help reduce the cost for commercially insured patients. So this will not include any government insurances, Medicare, Medicaid, or if you work for the government and have a Blue Cross Blue Shield government insurance, it doesn't count there. But if you have just regular Blue Cross, Moda, United, etc., most of the time you can use these savings cards to help reduce the price. They will let your insurance company cover whatever they're going to cover. So, like in a lot of cases with Ozempic, um, depending on what tier it is, it comes down to maybe $100 per month. Then you can use the savings card to bring it down to $25 per month. So that is a good deal. The bigger problem tends to be that most of these medications are subject to your deductible. So if you have a $5,000 deductible, you will have to meet that deductible before the insurance will pay any money towards the medication. So a lot of my patients get really excited that their PA is approved and it's going to be covered. And then they go to the pharmacy and the pharmacy says, oh, that will be $1,000 for this fill. And they're like, what the heck? What do you mean it's covered? Well, it's not covered until the deductible's met. And oftentimes, if you have a high dollar deductible, most patients don't meet that deductible until the end of the year, if at all. And so they never really even get to have it truly covered. There is cash pay available through Novo's pharmacy. Again, you have to have that type 2 diabetes diagnosis, but if you do and you want to cash pay, 0.25 milligram and 0.5 milligram are $199 a month for 2 months. And then the 0.25, 0.5, and 1 milligram doses are $349. And the 2 milligram dose is $499. I think that's because a lot of people do the partial dosing with that 2 milligram pen to make it last longer. In some cases, people can make that 2 milligram pen last 3 months or 6 months. So I think that's probably why they charge more for that, knowing that people are doing that. Wegovy is a once weekly injection. And as of mid-January, we also have a sorry, I think I said that wrong. Wegovy is a once weekly injection, and as of mid-January, we have a once daily pill. The FDA approved indications are chronic weight management in adults and adolescents 12 years and older. Your BMI needs to be over 30 or greater than or equal to 27 if you have any additional health problems such as high cholesterol, prediabetes, hypertension. So any of the metabolic associated comorbidities, as we call them, if you have those, you can have a BMI that is at 27 or above. There really isn't great insurance coverage for the weight loss indication. This is usually an employer-specific opt-in. In our area here in Southern Oregon, there are a few employers that have opted in to covering it for weight management, but that's just something we don't see very often. There is word on the street that the government insurance is Medicare and maybe some Medicaids. That's going to be state specific, but Medicare is going to have coverage for GLP-1 medications for weight loss coming soon. We were told maybe March, April. Now they're saying maybe in June. It's kind of, no one really knows. We also don't know which medications are going to be covered and what their rules for that are going to be. So that will be interesting to see, but it will be exciting because I think we're going to have it available for a lot more people. And again, each state is going to have to decide whether their Medicaid plan will cover. The next indication is cardiovascular risk reduction. I would also like to say that just because the FDA has approved it for something doesn't mean insurance companies will necessarily cover it for that. I have a lot of patients that will watch the news and will hear, oh, this is what they're, Wegovy is covering for this, or Zepbound got approved for this. And so they come to the office excited, thinking, oh, I have that, I can get it covered. Not necessarily. It just depends on what your insurance decides to do. So you will need to call your insurance company and figure out if they're covering it for any of these other reasons. But I am seeing that happen more often now. I'm starting to see better coverage, more insurance companies jumping on board. So for cardiovascular risk reduction, whenever I'm going to ask insurance to cover an expensive medication, I have to often submit something called a prior authorization. And in that prior auth, I have to say certain things in order for it to get covered. In a PA for cardiovascular risk reduction for Wegovy, I need to say that the drug is being used with a reduced calorie diet and increased physical activity. They want to know that we are making positive lifestyle changes. The patient needs to have established cardiovascular disease with a history of one of the following: a previous heart attack, a previous stroke, symptomatic peripheral artery disease as evidenced by intermittent claudication. So this is pain in your legs when walking that is caused by lack of oxygenated blood making it to your tissues. You need to have an ankle brachial index of 0.85. This is a specialized ultrasound on your leg that measures arterial blood flow. You can have a history of a peripheral arterial revascularization procedure or amputation due to atherosclerotic disease. Sometimes my mouth just doesn't want to say some of these words right. But if you've had, some of your toes cut off because they weren't getting proper blood flow, then you may qualify. Prior history of revascularization coronary artery bypass grafting, also called a cabbage. If you've had one, you probably know what that is, but they go in and put new vessels to help blood flow in the heart. Percutaneous coronary intervention or angioplasty. So if you've had any procedure on your heart to help the blood flow better to your heart muscle, then you may qualify. You also need to have a BMI greater than or equal to 27, and you need to be receiving guideline-directed management and therapy for cardiovascular disease, such as lipid-lowering agents, such as a statin, antiplatelets, beta blockers, or renin-angiotensin inhibitors, such as lisinopril or losartan. So those are what we have to say in a PA for cardiovascular risk reduction. The next indicated use is for MASH. I call it MASH because the full name always is a tongue twister as well. It's metabolic dysfunction associated steatohepatitis. You can never say it right. I hate these words sometimes, I tell you what. So we call it MASH because that's just easier. For MASH in a prior authorization, again, I need to say that the drug is being used with a reduced calorie diet or increased physical activity. The request is being prescribed or in consultation with a gastroenterologist or a hepatologist, a liver specialist. The patient needs to have moderate to advanced liver fibrosis consistent with stages F2 to F3 fibrosis. At baseline has been confirmed by one of the following: a non-invasive liver disease assessment, such as an ultrasound-based elastography, MRI elastography, or historical liver biopsy. If there are findings of fatty liver on labs, including increased liver enzymes and alkaline phosphatase, I will often order an ultrasound of the liver. Then usually the radiologist will make mention of findings of fatty liver. And in some cases, then we can go ahead with these more advanced diagnostics to measure. I usually do the ultrasound. And again, if there is that fibrosis, then we can refer to GI or the liver specialist. If your PCP works in a healthcare system that has something called an e-consult available, basically we can just consult with the gastro and say, hey, I have this patient, we've done this test, it has this diagnosis. Would you recommend that we start Wegovy for treatment? And as long as you have that consultation and they say, yes, I agree, then we can usually just submit that to the insurance company as a way to get it covered. But that's not available at every healthcare facility. For prices, for our Wegovy pill, the 1.5 milligram and 4 milligram doses are starting off at $149 per a month. I hear they will go up to $199 per month in a few months. The 9 milligram and 25 milligram doses are $299 per month. For the Wegovy injections, again, for the first 2 months, they give you a little discount, 0.25 and 0.5 milligrams, $199 for 2 months. And then every single dose, which includes 0.25, 0.5, 1.7, and 2.4 milligrams, are all $349 per month. And this is cash pay through the Novo Pharmacy. Contraindications. Personal or family history of medullary thyroid cancer. This is a more rare type of thyroid cancer. Most common thyroid cancers are in the nodules that sit on top of the thyroid. This is called papillary thyroid cancer, and it accounts for about 85% of thyroid cancers. Medullary thyroid cancer is inside the thyroid and is known to spread to the lymph nodes, which is not the case with the papillary thyroid cancers. So if you have a family history or personal history of the papillary, the nodule thyroid cancer, you can still use these medications. It's only the medullary that we can't. Other contraindications include multiple endocrine neoplasia syndrome type 2. Again, if you have that. You probably know if your family has that. Pregnancy. They say you should stop 2 months prior to starting trying to get pregnant. There has been a lot of surprise pregnancies. I think it was on the news, Ozempic babies, women with PCOS, when they start using these medications and all of a sudden their metabolic system, starts working better, all of a sudden their fertility gets better. And there's been a lot of surprise pregnancies. So obviously, if you find out you're pregnant, stop using the medication. It just hasn't been studied, and it's very hard to get studies for pregnancy because nobody's really willing to risk the health of their babies. So, any information we do get is usually because, oh, this lady didn't know she was pregnant for 6 months. She had one of those cryptic pregnancies. And then we can kind of get a little information from that. But we're not going to generally have any dedicated studies just because we're not willing to risk those babies. And then obviously, if you've had a known allergic reaction, don't use it. Use with caution if you have a history of pancreatitis. Generally, that can somewhat be a contraindication. If we know that anybody's had really severe pancreatitis, we oftentimes shy away from the medications. And if you do end up getting pancreatitis from the medication, it usually kind of excludes you from using it again. Kidney issues. Now we said, oh, it can help the kidneys. Yes, but we have to be careful here. And where I see it as a problem is when I have people with chronic kidney disease, and if they're super nauseated and if they're vomiting, they get dehydrated and it stresses their kidneys. So I really talk to my patients about the importance of staying very well hydrated while on the medication. And if they are vomiting or they are having diarrhea or if they are having those issues, they need to let me know right away. We need to work on that. And we need to make sure that we don't stress the kidneys out, especially if they have chronic kidney disease, but even if they have healthy kidneys, because healthy kidneys get stressed really easy. I always say the kidneys are like the drama queens of the body organs. They get stressed super easy. Diabetic retinopathy, there has been some cases of people having a worsening of their retinopathy. Usually, if I know my patients have diabetic retinopathy, I request that we get the okay from their ophthalmologist before we go and use this medication. Severe gastroparesis, another one, it some people can develop gastroparesis. That's where your stomach kind of becomes paralyzed and doesn't digest well. It can lead to vomiting. So if you have a history of that, again, I don't know that we would recommend even starting, but it's something we watch out for. The most common side effects: nausea, vomiting, constipation, diarrhea, and abdominal pain. As I discussed in my intro video, if you watched it, I did try both Ozempic and Mounjaro at one point, or sorry, semaglutide and tirzepatide. Um, and I had really severe side effects on the higher doses. On the lower doses, did fantastic. The higher doses were just too much for me to handle. I had to stop. The juice was not worth the squeeze, so to speak. I've had some patients with no side effects whatsoever and have done fantastic. I've had others that just have minor side effects and they can deal with it and they can put up with it for the good stuff they're getting. It just really depends on the patient. Okay, next we have tirzepatide, which is Mounjaro and Zepbound. This is through Eli Lilly. That's the pharmaceutical company. Um, First, Mounjaro, it's a once weekly injection. The FDA approved indications is for type 2 diabetes, now approved for 10 years and older. So if we have a 10-year-old with type 2 diabetes, which we are seeing more of that, then there is now an FDA approved indication for that. Doses and prices, we have several doses, which is kind of nice, a little more than we see with Ozempic. We have 2.5 milligram, 5 milligram, 7.5 milligram, 10 milligram, 12.5 milligram, and 15 milligram. Again, if you have insurance coverage for it, it can be as low as $25 if you have one of their savings cards. For patients with commercial drug insurance who do not have coverage, you can get it for $499 per month with the savings card. Again, that tends to be out of reach for a lot of people, but I have had patients that would pay that much and even up to $1,000 a month to get access. So, Zepbound is a once weekly injection. It has the FDA approved indication for chronic weight management for adults with obesity. Again, it's going to have that same, over 30 BMI, or 27 and higher if you have a comorbidity. It also has been approved for use in obstructive sleep apnea. I am starting to see a little more coverage recently for this. You have to have established moderate to severe obstructive sleep apnea in patients with obesity. This has to be shown on a sleep study, and you have to have been utilizing a CPAP machine. You can't be diagnosed and have had no treatment at all generally. That's what they want in the prior authorization. Um, Doses and prices, the doses are exactly the same as the Mounjaro. Literally, and people ask me all the time, what's the deal with this? Mounjaro and Zepbound are the exact same medication. It's tirzepatide. It's dosed the same way. So why the heck do we have two different names for them? It's really for insurance companies to figure out why it's being prescribed. Mounjaro is for diabetes only. Zepbound is for weight and, obstructive sleep apnea. So it's exactly the same medication, dosed exactly the same way. Where with Ozempic and Wegovy, it's the same, it's semaglutide, but it's dosed slightly different. Again, if your insurance company covers it, it can be as low as $25. I don't see it covered very often. Again, that's an employer-specific opt-in on that. Cash pay prices, 2.5 milligrams for it's $299 per month. 5 milligram dose is $399 per month, and all other doses are $449 per month. The contraindications, cautions, and side effects are pretty much the same as semaglutide. So all the things I said before are going to also apply to Mounjaro. Remember, this is it's essentially, semaglutide again is a GLP-1. This is GLP-1 and GIP. Surprisingly, though, I do often see less side effects with Mounjaro and Zepbound, which seems weird because you'd think, okay, there's two hormones instead of one. Something in my brain would say, oh, maybe more side effects. Actually tends to be less side effects that I've seen. Now, it really is patient by patient because I've had patients that say they felt better on semaglutide. I've had patients that say they feel better on tirzepatide. I've had patients that feel one works better than the other. Each patient's going to respond to things differently. So, I usually tell patients when they say, well, which one should I use? Well, which one can you afford? Which one can we get covered? If you have cardiovascular disease and we can get Wegovy covered, we should use that one. If you have obstructive sleep apnea and we can get Zepbound covered, we should use that one. If you're having to cash pay, the Wegovy tends to be a little less expensive, and if you can afford it, you should use that one. It really oftentimes comes down to which one is affordable and attainable. Okay, so which ones work better? Well, again, a lot of patients will say one works better than the other, but as far as clinical data goes, um, let's see what the studies have said. So semaglutide versus tirzepatide versus retatrutide, which is not yet available to us, but coming soon. So here we have about the time frame that they did most of the studies for semaglutide, Wegovy, Ozempic. The time frame was around 68 weeks, and the average weight loss in trials was around 14 to 15% of body weight. For tirzepatide, Zepbound, and Mounjaro, the average time frame was about 72 weeks, and we saw about a 20 to 22.5% loss of body weight. And retatrutide just coming in hot and blowing the other two out of the water, it seems like. We'll see. The average time frame was 48 to 68 weeks, and we are seeing an amazing 24 to 28.7% body weight loss. That is insane. So what does that mean in real weight? Okay, let's use the example of a 220-pound patient. That would mean that on semaglutide, the average loss would be about 30 to 33 pounds. Tirzepatide would be 45 to 50 pounds, and retatrutide 55 to 63 pounds. That is pretty amazing. So probably one of the biggest questions I get are these medications safe? Overall, I would say yes. The GLP-1 medications are considered safe for most people when prescribed and monitored by a healthcare provider. These medications have been studied in large clinical trials and used by millions of people for diabetes and weight management. However, like all medications, they have benefits, risks, and side effects that patients should understand. So, um, again, we've talked about what the GLP-1 medications are. We've talked a little bit about what they do. Talked a little bit about side effects. Um, Again, they're overall considered safe because they have been studied pretty extensively at this point. Large clinical trials involving tens of thousands of patients have shown that these medications improve blood sugar control, help with significant weight loss, reduce the risk of heart attack and stroke in patients with diabetes, improve metabolic health. Some have even been shown to protect the heart, which is why they are often recommended for patients with diabetes and heart disease risk. The side effects for most people are mild and temporary. Again, the nausea, the feeling full quickly, the decreased appetite, which is kind of what it's supposed to be doing, mild stomach discomfort, constipation, vomiting. Some people get diarrhea. And most of these occur because the GLP-1 medications slows stomach emptying and affects appetite centers in the brain. So I actually tell a lot of my patients, really, if you adjust how you're eating, you can oftentimes improve these symptoms. So, you're going to want to eat smaller meals. Don't overeat, obviously. Don't eat really heavy, fatty meals. It's just going to sit in your stomach for a long period of time and cause upset stomach and indigestion. Don't eat too late. Don't eat too close to bedtime. I mean, it kind of forces you into some better eating habits anyway. So oftentimes just adjusting how we're eating can help. Um, Drinking protein shakes if you don't feel like you can handle a full meal, you still want to get that protein in. Um, there are some less common but possible risks. We touched on these a little bit. Pancreatitis. This is inflammation of the pancreas, and it's been reported. It tends to be more rare. I've had a few patients get pancreatitis. Symptoms to watch out for include severe abdominal pain, that right upper quadrant. It kind of radiates to the back. It can cause persistent vomiting. If these symptoms start to occur, you need to let your provider know immediately because, we need to check those lipase levels. You need to stop the medication. Unfortunately, once you've developed pancreatitis with the medication, it usually keeps you from being able to be prescribed this in the future. Gallbladder problems. This is going to potentially occur with any rapid weight loss. It's common in people that have bariatric surgery. Obviously, on the GLP-1 medications, a lot of people are losing weight rather quickly. So rapid weight loss can increase the risk of gallstones and gallbladder inflammation. Again, that really intense right upper quadrant pain. If that's occurring, go to urgent care ER, let your provider know, because sometimes that can be really serious and may require surgery. The risk of a thyroid tumor, very rare. Again, that's why we have that contraindication saying if you have a family history or personal history of medullary thyroid cancer. In animal studies, some GLP-1 medications caused a thyroid C cell tumor. This has not been clearly shown in humans, but because of this possibility, they are not recommended, again, with the people with medullary thyroid cancer or the multiple endocrine neoplasia type 2. So again, we're going to ask if you're seeing a healthcare provider. That's why these medications really should be coming from a healthcare provider. I know a lot of people, it's getting really popular for people to buy them online, and not having really guidance with them. And so I've seen patients get into some trouble, either because they started at too high of a dose, they tried to increase their dose too fast. Um, I do get a lot of patients that ask me about compounded semaglutide and tirzepatide. There was a short period when the medications were on a medication shortage list, and there is a loophole in the law about generic medications. When a medication is brand new, they get some patent protection. This is the time when they are allowed to, I guess you would say, price gouge us a little bit. It's supposed to be intended to help them recoup their cost of research and development of the drug. And so there are not allowed to be any generics on the market during that time period. But if the medication goes on shortage, it allows compounding medications to make a chemically similar medication. So basically allowed to make generics while the medication is on the shortage list. So there was a period when both tirzepatide and semaglutide were on the shortage list, and it did allow these compounding medications to pharmacies, sorry, to start creating these medications. And there's a lot of legitimate compounding pharmacies here in the US. And so there were some safe, attainable generics compounds available during that time. But I'm sure you've heard on the news or on the internet that early last year, both medications came off of the shortage list. And so there was a order from the court for the compounding pharmacies to stop producing the medications. And so technically right now, any compound that's on the market is making the law. There's been a lot of lawsuits. Um, and this is mostly going to affect, I think the really legitimate compounding pharmacies have stopped producing. The ones that are still making it to the US are oftentimes coming from overseas in facilities that are not FDA controlled. And where that's a concern is that there's no one overseeing whether or not any bad stuff is making it into those medications. And there have been some that have been checked that showed um, substances that shouldn't be in there or that could maybe be unsafe. It gets a little risky. And so, some people would say, well, this is just the pharmaceutical company's way of trying to scare people because they want them to buy the expensive stuff. And um, I don't think that's necessarily true. When I knew that there were the legitimate compounding pharmacies producing the medications, I told my patients I'd be happy to guide you on dosing and everything else, but now it's, there's just no way to guarantee that you're getting a pure good product. And so that can just be a little scary. So I do tell my patients to, use that at their own risk, unfortunately. So I really just wish that the medications were more attainable for more people because I do think they have the potential to help a lot of people. Um, so, yeah. So you may be wondering if GLP-1 medication would be right for you. This would be a great talk to have with your PCP. Of course, you want to make sure there is no underlying health problems that would be contraindicated in you starting those medications. Then it's really a question of whether your insurance company covers it or if you can afford the cash pay prices. I know for many people, the cash pay prices are still way too steep. Like I said, we are expecting Medicare and maybe some Medicaid plans to start having coverage for the weight loss indication, but we really don't know what that's going to look like yet. I also hope that this means that we will start seeing more coverage on the commercial insurance plans as well. If you do get started on one of these medications, make sure to keep close follow-up with your provider and always report any significant side effects. Also, make sure and watch my next video talking about tips and tricks to be more successful on these medications. Again, I am so proud of you for showing up for your health. And thank you for making me part of your health journey. I hope you have a great day, and I'll see you soon. As always, if you enjoyed today's video, please hit the like button. Maybe even drop a comment telling us what you liked and even what you did not like. If you want to see future videos, hit that subscribe button. This will also really help to support our channel and help us reach more people. Also, visit our website at goodhbl.com. This is where you will find the products that we talk about, but also downloadable versions of all the information we make videos about so you can use it for future reference. And again, thank you for making us part of your health journey.